the Civil Service Board agenda. So I just wanted to provide that background. The first agenda item is the public comment on agenda items. I don't believe we have anyone that has signed up. And then moving on, and then community voices, where members of the community can speak on any public health issue, even if it's not on the agenda. And I don't believe we have anyone to sign up for that either, correct? That moves us to our third agenda item, is declarations of conflicts from members of the board, either in any conversations we've had with each other regarding regarding agenda items on today's agenda. And I'll make space if anyone has a declaration. I do not. Okay, hearing none, that will take us to the next agenda item, deliberations of grant applications. Mr. Diamond, I don't think we have grant applications, do we?
Yeah, no application.
Okay, so that takes us to grants and contracts. Mr. Diamond.
Yes, Chair, Council Members Board, we have 9 grants and contracts for your consideration. Item number 1 is a grant to the Blackman Health Village for $30,000, a community safety initiative. Item number 2 is another community safety initiative for We Are One Recovery for $32,000. Item number 3 is a sub-grant to Give Good Health for the Ryan White Party Program, $211,866. Item number 2 is also a sub-grant for Ryan White Party to Streetworks, $452,444. Item number 5, sub-grant from the Harry Medical College for the Ryan White Party, $563,908. Item number 6 is a grant to Refine Institute for Community Safety Institute, American Initiative, $159,000. Item number 7 is a Ryan White Party sub-grant to Vanderbilt University Medical Center for $765,882. Item number 8 is a sub-grant to National Cares for the Ryan White Party, $1,628,095. And finally, item number 9 is a sub-grant for Ryan White Party for We Are One Recovery, $276,202.
Thank you, Mr. Diamond. When ready, I will entertain a motion. Motion to approve the grant. Okay, thank you. Ms. Whitehead, is there a second?
Second.
Second, Dr. McDonald. Discussion.
Could you give us a little overview about the Ryan White and where we are now and what the expectation is, or with all these grants?
Could you, Ms. Glaze Johnson is here as well, but could you kind of clarify your question as far as where we are right now?
Like, we're expecting that all this money is going to come through.
We are fully funded in our Ryan White for this contract period. So all of the federal funds have been approved, and the board has received them. I believe last month the board received the final allocation of 3. So
there's no expectation that this is going to change.
Correct.
Any other questions or comments? Hearing none. All in favor of approving the grants and contracts? All right. None opposed. Motion carries. Thank you, Mr. Diamond. And that brings us to the conclusion of the Board of Health meeting. I will entertain a motion for adjournment. Motion made by Dr. McDonald, seconded by Ms. Powell. All in favor? All right. None opposed. Board of Health meeting is adjourned. I hereby open the Civil Service Board meeting. Mr. Shelton has the first agenda item. Deliberate on scheduling a public hearing regarding Civil Service Rule 4.5, subsection A, subsection I, and subsection B.
Thank you. A proposed revision for the MPHD Civil Service Rule 4.5 is in order. Again, you went through the subsection A, I, and B. The reason for this is there is a step change in the promotional process of the adopted pay plan. The new pay plan is actually based on a 3-step promotional process, which gets us to what the pay would be based on a promotion. In our own rules, we actually have that as a two-step process, which is what it was previously. The proposal is to change that wording from 2 to 3, basically making the pay plan valid for us.
All right, when ready, I will entertain a motion for scheduling the public hearing for us to consider this at a future date.
I'll motion to schedule a public hearing.
Motion made by Dr. McDonald,
Seconded.
seconded by Ms. Whitehead. Is there any discussion? All right, hearing none, all in favor? All right, none opposed, motion carries. Thank you,
Thank you.
Mr. Shelton. And I hereby adjourn the Civil Service Board meeting. Thank you, everyone, for coming out and spending 5 minutes here, but it was well worth it because these contracts needed to get out. So, so thank you. Thank you. All right. That's it. It's very anticlimactic.
Very.
So,
Our two-hour meeting.
yes.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.